Welcome back. A January 2021 study shows substantial differences in dissemination of COVID-19 infection between different race groups, most likely explained by historically based differences in socioeconomic status and housing conditions. To talk more, though, about how blood donation has been impacted following a decrease in donations, Dr. Karin Berg, who is the medical director of the South African National Blood Service, joins us. A very good evening to you, and thank you so much for speaking to us. So let's talk about seroprevalence and how it helps us understand COVID-19, the infection rate, and the differences in the subgroups.
So with the seroprevalence studies that we do, we are able to determine how many of our donors were exposed to the COVID or SARS-CoV-2 virus over the last year or so. In particular, the assay that we use has been found to be quite sensitive in detecting antibodies, and also that they are able to pick up antibodies for about a year after somebody's been exposed, or at least a year after somebody's been exposed. And so through the work that we do, we are able to then, over a period of a year, see how the prevalence of COVID infections have changed in the different provinces. And that really is how we use this kind of research, is to monitor and track the spread of the epidemic amongst our blood donors. And from that, we are able to some degree, not 100% accurately, able to postulate back what we think the prevalence in the general population might be at a given point in time.
Mm-hmm. So how does seroprevalence vary with both statistical and epidemiological significance?
So what we have seen is in our study, due to logistical factors and access to the reagents we need to do the testing, we were able to perform the testing first in 4 provinces, the Eastern Cape, KwaZulu-Natal, Northern Cape, and Free State. And we did that in January. And then we were able to access additional reagents, and we then tested the rest of the country. And what we saw that statistically, a small difference of maybe 3-4% between the provinces might have been statistically significant, but perhaps not epidemiologically so. But what we are seeing is the prevalences range from as little as around 35%, so about 1 in 3 people in Gauteng, and that is in May, compared to about 2 out of every 3 people in the Eastern Cape, which was in January. And so, that at the epidemiological level is actually very significant. That means that the spread of the virus actually appears to have been different between and across the different provinces.
But I believe that the difference also lies in age, gender, and race. How significant a difference is there? And I also want to find out if you're able to have a full picture, given the fact that, as we mentioned in the beginning, that the number of donors has dwindled significantly because of COVID-19.
Okay, so firstly, in terms of the gender and age, we didn't really see a significant difference at that level. We did see a significant difference between the ethnic groups or racial groups in South Africa, with the highest prevalences across all of the provinces seen amongst our black donors, with the lowest prevalences found amongst the white donors. And that probably has a lot to do with the historical context and the housing, the ability of people to socially distance. And so within that, I think it is important information for us to have. In terms of the decrease in the donor population, so while we have seen a reduced number of people coming in to donate, and in fact it's really difficult for us at the moment because our donor pool have shrunk by as many as between 10 and 20%, depending on where you look at. We still were able to test in total 20,000 donors, which is a substantial study population and does enable us to make inference around what the prevalences would be in the general population. I do think the one thing that we always say this, is that our general population does not, it doesn't represent the general population really well. We exclude people that have certain serious illnesses. People under the age of 16 can't donate. We are underrepresented in terms of older donors and so forth. But with statistical methods, we are able to, at least in some way, extrapolate the information back into the general population.
Now, I want you to just break down the science, because as we've seen worldwide, there's been a dangerous phenomenon of people using race and ethnicity to denote blame in terms of how quickly the virus is spread. So based on what you're saying, that there's a higher prevalence amongst those who are defined as previously disadvantaged or black. Now, when you look at the sampling, I mean, vis-a-vis the population size of various racial groups and your findings, how do we understand what you're saying so that people don't obviously carry some misinformation campaign based on their own beliefs? Just break down the science for us.
I think it is utterly important to remember that this virus is spread through close contact, and your ability to wash your hands and sanitize and wear a mask. And so when you are within a context where these things are not possible, then your ability to prevent the spread of the virus is limited. And so while at the face value, it appears as if the virus is spread more predominantly through our black communities, I think if we were able to geographically pinpoint, we would be able to see that the people who have been able to protect themselves from contracting this virus are people who live in houses where there is a single family of maybe 3 or 4 people living in that house, people that have adequate access to running water, who have access to be able to sanitize regularly, people who are able to work from home. And so I think, and it's a very, it's something that we really try and avoid to do, but I think to just ignore it is also dangerous. But this is not a reflection of the race of our donors, this higher prevalence amongst the black donor population. It is really just a reflection of one's ability to protect yourself from the virus. So our black population are the people who are working, who have to travel by taxi, they have to travel, they have to work often unable to work from home, often socioeconomically unable to protect themselves through adequate social distancing and so forth. So I think that is a really important message to understand, that this is more a reflection of economics than what it is of race.
All right, and I wanted us to consume that responsibly. As I said, people are prone to manipulating information on the basis of the understanding they seek. Thank you so much for speaking to us and sharing the information from that study with us. Dr. Karin van den Berg is Medical Director of the South African National Blood Service.